Okay, good afternoon, everybody. Thanks so much for joining us. My name is Xochitl Flores. I'm the Associate Director of Foundation Relations with Western Center on Law and Poverty. I'm a community worker, a mother, musician, professor, and I will be serving as your moderator for this conversation. I'm gonna introduce the panelists, and then I'll go on and provide some context, and then the panelists will all speak. So first, I want to thank our partners in this Meet the Advocates, Black Women for Wellness Action Project and California Black Women's Health Project. The first panelist I'm going to introduce is Onyema Obiekia. She is the Policy Director for Black Women for Wellness and its sister organization, Black Women for Wellness Action Project. She began her work in reproductive justice as program coordinator for Black Women for Wellness, Get Smart Before You Get Sexy, the comprehensive sex and sexuality education program of the organization's reproductive justice focused work. Onyema she holds a Juris Doctor from Northeastern University School of Law and a Master of Public Health from Tufts University School of Medicine. She's committed to contributing to the global realization of reproductive justice by leveraging her training and experience in the field. In her free time, you can catch her trying to fail as a plant mama. Me too. Taking a dance class of the African diaspora, researching and crafting recipes, and when weather permits, going on morning hikes. Welcome, Onyema. The second panelist I'm going to introduce is Raina Granberry, an Inglewood native and Spelman College alum. Raina Granberry is a health equity strategist and director of maternal and reproductive health at California Black Women's Health Project. She has worked to ensure better outcomes for pregnant Black women, people, and families with the Los Angeles County Department of Public Health, Cedars-Sinai Hospital, Watts Health Clinic, Maternal Health Now, and California's Black Infant Health Program. In 2019, Raina was selected to the Women's Policy Institute, now the Solis Institute, LA County Health Justice Team, where she co-wrote and helped pass a countywide doula expansion motion for those most impacted by birth disparities. She also serves as a Pritzker Fellow with a focus on equity and systems integration in maternal, child, and adolescent health programs at LA Department of Health. Thank you and welcome, Raina. We have with us Western Center staff, Etisha Burrell, our senior health advocate, four generation San Francisco native, community doula, a wealth of knowledge. And we have, last but not least, I'm going to introduce Sandra Poole, our policy advocate based in our Sacramento office. She brings an incredible wealth of knowledge for policy and public administrative experience to Western Center. She was the policy director for California Black Health Network and held policy positions in nonprofit organizations focusing on mental health. Prior to her nonprofit experience, Sandra worked for, the director, she was the director of the State Disability Insurance and Paid Family Leave Programs at the Employment Development Department. So welcome, Sandra and Etisha, Raina, and Onyema. So I'm gonna give us some context for our conversation. I'm gonna provide some background information, and then I will ask each of the panelists some questions. The United States has the highest maternal mortality rate in the developed world. While California's maternal mortality rate is among the lowest in the country, a recent study by California Department of Public Health found that women of color, specifically Black women, die of pregnancy-related complication at rates more than 3 times that of white women, Evidence suggests one key cause of this disparity is the implicit bias of healthcare providers. A provider's level of bias, whether conscious or unconscious, can influence their interactions with patients and their diagnosis and treatment of the patient's pain According to a 2021 report from the Center of Disease Control and Prevention, implicit bias and differences in the quality of health care can play a role in disparate treatment, and found that more than 80% of pregnancy-related deaths in the US were completely preventable. There are other reasons for the disparity in maternal mortality rates in California, including lack of access to quality care and the crisis created by the rampant closure of maternity and labor wards throughout the state. Our panel today will discuss the challenges related to these disparities and the impact on Black birthing people, and will also share some of the grassroots efforts underway to continue identifying and responding to some of these disparities. So, sorry, everybody. To my questions. For my first question is for Onyema. Given the state of Black maternal health in California and the challenges faced in responding to these disparities, we want to take a few minutes to hear about the work on the ground occurring with your organization here today. Can you tell us a little bit about the Black Women for Wellness Action Project and some of the work you're doing to address Black birthing and reproductive justice disparities?
Thank you, Sochil, and good afternoon, everyone. My name is Onyema Obiekia with Black Women for Wellness Action Project, but of course, folks might be more familiar with its older sister, Black Women for Wellness. We are both reproductive justice community-based organizations committed to the empowerment, health, and well-being of Black women and girls. And to answer this question, I'd love to, and I didn't start my timer because brevity is not my strong suit. So Sochi, please tell me when to. Uh, um, Committed to the empowerment, health, and well-being of Black women and girls. And Black Women for Wellness, our older sister, was established in 1997 with an inaugural program called the Shangazi Project. And that Shangazi is a Kiswahili term that, when translated to English, is about the equivalent of aunt, or translates to aunt. And it was a program that paired pregnant mamas with, and birthing people with, their so-called aunts, right? These mentors who had already gone through the birthing process, who had already, who kind of understood, right, what it was that Black mamas were going through pregnancy. And so the idea was to have a mentor during pregnancy and through a year postpartum to support Black mamas in the birthing process. And so I like to share that story because birth equity, we've always been preoccupied with the experiences and ensuring that Black mamas and birthing people have joyous, healthy, safe experiences as possible. So we started off with the 501(c)(3, doing programming and education and outreach, but we also understood that systems change was a critical aspect to advancing improved health outcomes for mamas and babies, but just generally reproductive justice as a whole. So, you know, we started engaging in some policy work at the systems level, but in 2016 decided that we wanted to flex our power and harness our community's power in a different way. And so we established Black Women for Wellness Action Project, which is the 501(c)(4) organization. And we engage, the way we do the work there is we harness community power, we build electoral power, we build legislative power, and we engage in narrative to shift cultures, right? And so our thinking is that we ensure that we elect candidates that we can build to become champions for reproductive justice issues, but also, right, elect those who will work on behalf of our communities to support advance health equity more generally, but of course, grounded in the reproductive justice framework. Reproductive justice, what is that? What is that? It's a human rights-based framework. It's a legitimate framework that is studied, and there's a lot of reading behind it, but it has 4 core tenets. It's the right to have a child, the right to not have a child. In the event that you do have a child, that you're supported with the infrastructure to raise your family with dignity and safety. in safe and healthy environments. And then it's the right to bodily autonomy and sexual pleasure. And this framework actually is a mandate on the government to create the circumstances in the environment for us to realize these tenets, right? And so all of the work that we do is grounded in reproductive justice in that principle. It's very intersectional in how we think about it. So when we advance legislation, that's typically the vein in which we do our work. So we've led the work in terms of we've passed some seminal legislation in partnership with our partners at Western Center on Law and Poverty. And we work with California Black Women's Health Project in a lot of our programming work on AIM and a lot of our work in LA, but we've worked to advance and get past Senate Bill 65, authored by Nancy Skinner, the California Omnibus Act, which brought us, right, like Medi-Cal doula benefit and guaranteed income pilots across the state, and the Midwifery Workforce Act that now allows for building a pipeline of culturally and racially concordant midwives, right, in California. There's some issues around that with some of the midwifery schools closing, but that's a story for another day. SB 464, the Dignity in Pregnancy and Childbirth Act, that's mandating implicit bias trainings. Like we've worked in partnership with Western Center, and I know Sandra will talk about that a little more. So we've been really working, we've passed some legislation at the intersection of housing and pregnancy, again, recognizing that tenet of, being able to raise your family with dignity. Anyway, passing intersectional legislation, right? Taking a multi-pronged approach to address critical issues that impact our communities. So I will step back because that feels like a minute, like a while, but happy to
Thank
answer
you.
questions.
Thank you, Onyema. That was great. Yeah. Intersectional, multi-pronged approaches because we live full lives. We are full humans. Reina, can you tell us a little bit about California Black Women Health Project and what you all are doing on the ground to address some of the issues that we just mentioned a little bit earlier?
Absolutely. Hello, everyone. Happy to be here with you all and talk a little bit about the California Black Women's Health Project. So in the California Black Women's Health Project, similarly to Black Women for Wellness, has been around for a long time. We've celebrated our 30th anniversary this year. And one of the key tenets of our organization is around mental health broadly. And so we take that approach in maternal health as well. But in our maternal reproductive health program, one of our key components is to build community-defined evidence practices. That's where we spend our time. That's where we do a lot of our investments. And what that means for us is you hear a lot about evidence-based. The things that get funded are if they're evidence-based. The things that receive credibility from the clinical space and the medical space are when they're evidence-based. And one of the things we want to do is really lift up the community-defined evidence base. What is it that has been happening in our community for a very long time that hasn't had research backing or hasn't been, acknowledged by the government? But everybody in this community knows that it works, and it's something that we've all bought into. And so by that term, we really invest in the leaders and the folks who've been doing this work. So a lot of technical assistance and training for birth workers. We have what we call our ambassador program, and we have it up and down the state where we're really investing into folks to continue to build on what they have. So maybe they don't have a 501c3, but they're already there and respected. And so we, can kind of re-grant and support and build up their work and connect them to, public health agencies and all the agencies who we work with and have the credibility with. So that's one of the main things that we like to do. And sort of part of that support can mean a lot of things. So some of the support is even that mental health support that is not only available for Black birth workers and families, but even Black physicians. We've gathered Black physicians together to really see what they're dealing with, because they also deal with some of that implicit bias that Onyema talked about in their work. Another piece of that support would be we do one-on-one help for doulas who want to enroll as Medi-Cal providers. So with the Medi-Cal benefit, doulas can enroll as Medi-Cal providers. A lot of doulas are having some troubles enrolling into that program. And though a lot of people have done webinars and different education on it, once the doula sits in front of her computer, a lot of that is lost, right? So we have a community member who is a doula who's done this work for a long time, who enrolled herself as a Medi-Cal provider. And now we are compensating her in order to help other doulas one-on-one enroll as providers. So we really get to the grassroots level and really build up leaders in our work. So that's one of the things that I want to share with you. We also do a lot of fiscal sponsorship. We do business training for doulas for sustainability. You know what? You shouldn't have to go get a job at the county or somewhere else. What can retirement look like for you as a trusted birth worker? We watch a lot of people get burnt out after they've been the person that the community has relied on for a long time. And then people are like, I want this person to be my doula. She's sick or she's gone or she can't do this anymore. And she wants to go get a regular job. And we don't want that to happen because we really respect the work and we know that those doulas are crucial. And we also want to create a pipeline for them into midwifery. So that is another piece of investment that we're doing, supporting folks, getting them compensation so that they can go to midwifery school. There's a lot more that I could talk into. I guess I would say in our policy realm, you know, Black Women for Wellness Action Project just kills it over there. So we just really support a lot of that work and work across the state. But one place where we have sort of established ourselves as leaders is in the reparations space. We really believe that reparations can be key in addressing the maternal health crisis in California. And so we've really been bringing folks together, talking to legislators, talking to community members about how can we include some of those things into reparations and really get an education out to the community that even though we want checks, it's not all about money and checks. A lot of this, there's a lot of opportunity to fix health problems in our community. And lastly, I'd say we work really closely with government agencies and other service agencies to provide technical assistance, equity workshops, really talk to them about anti-Black racism and how we can get into that and really notice that in our work, and what can we do to change that. She mentioned some of the work with Pritzker, and in there, we're really working with county departments to sort of integrate systems. One thing we don't think about is the burden on families, especially system-impacted families, if they got 25 people they got to talk to. They got a social worker here and a person at the doctor's office and a person from the school. So really just talking about systems integration, which folks don't think is important in maternal health, but it typically is because these are our mamas and they're having to deal with these issues while they're pregnant or even when they have young children. Yeah, so I'm sure we can share a lot more and maybe we can get into it in the question and answering.
Thank you, Raina. Congratulations on 30 years. Amazing work. Yeah, and on that.
Some of our partners here too. I just want to say hi. I see Deborah and some other folks who support our work. So I just want to give y'all a shout out.
Thanks. Thank you so much. Itisha, Western Center has prioritized Black birthing justice as a critical issue to address. Can you tell us about some of the work you're doing to address disparities we highlighted earlier?
Yeah, thank you.
Yeah,
So I've been at Western Center for almost a year now, and I was specifically brought on to support the birth justice and reproductive justice work that Western Center has been focused on. And I come to this work as a community-based doula, as Sochi shared, and that really grounds me in my passion for advocating for community to have access to safe and supportive birthing spaces. So a part of what I have been focused on in my work is really lifting up community voice and really making sure that community has a seat at the table when we're talking about legislative proposals, when we're talking about redesigning some sort of policy or creating some sort of campaign or training. Oftentimes as organizations, we think we know what's best for community, but we don't always ask what does the community actually want. And we saw how doulas, including myself, organized to really advocate for a better benefit for Medi-Cal recipients. And that process was a long and arduous process, but it was worth it in the end, in that we were really able to fight for a lot of the things that we wanted to see the benefit look like. And so a part of the work that I'm doing is to make sure that now that the doula Medi-Cal benefit has been rolled out, what does it look like to properly implement a huge benefit like this and make sure that everybody is having access to it? And so something that I've been working on is continuing to be a part of the doula access work group continuing to listen to folks who are on the ground and actively supporting clients as Medi-Cal providers, being able to understand what the barriers may be to becoming a Medi-Cal provider, and what barriers may exist for reimbursement or contracting. And what we found, as my being a part of that work group, is that there are some barriers when it comes to contracting with managed care. And so we have developed a training for the contracting process so that folks can better understand how to contract with managed care plans, how to understand and interpret a contract, because a lot of times folks are signing a contract for the first time, and haven't seen a provider contract like this. And sometimes the language in there is more geared towards a traditional physician or licensed provider rather than a community-based provider. And so we have partnered with a pro bono law firm to develop a webinar, a fact sheet, and really provide a space one-on-one for folks to also be able to get their questions answered. So it's kind of like a three-part project that we've developed to be able to support folks with understanding that contracting process. And then once they get contracted, then being able to ask questions about what does it mean to be a contracted provider. Another thing that I've been working on is being a part of the Midwifery Access California. It's a coalition with midwives and midwife supporters. It really was inspired by the movement that spurred when doulas said, hey, like, nothing about us without us, really making sure that, again, that community voice was a part of the design of that Medi-Cal benefit. And so midwives throughout the state, they've now come together to form this coalition to listen to each other, to understand, there's been a benefit available to Medi-Cal recipients for years now, but how many folks in our community actually know that midwifery care is a covered benefit? And so being a part of that work group, again, allows me the opportunity to listen to where there's some more advocacy needed to change policy, to improve policy, but then also how do we get the education, get the word out to community. And so there is a webinar series planned for the rest of 2024, 2025, and I will be presenting at one of those webinars, which is going to be about the difference between a doula and a midwife, and how do you access both benefits as a Medi-Cal recipient. And so stay tuned for that. We'll share more information about how to access that training or that webinar, as well as the contracting webinar. And then another thing I've been working on is developing a Know Your Rights fact sheet, which really speaks to what I was just sharing. Is like there's a lot of benefits related to pregnant people who are new parents, and what we found is that a lot of folks don't know that these benefits exist or how to access them, who to call. How do you make sure that you're not paying out of pocket if you're a Medi-Cal recipient? How do you get your services covered if you have to go out of network? All of those nuanced things about accessing benefits, I'm working on putting into one consolidated fact sheet about knowing your rights as a pregnant person or a new parent in California. And then lastly, another project that I'm working on is the new Title IX language has recently been finalized. And really what this is about is advocating for folks who are pregnant or new parents on college campuses. And my focus is on college campuses in California, in LA County, and making sure that, again, people know what their rights are as a student on campus who is pregnant, to make sure that their education is not interrupted by their pregnancy, and that they're not wrongfully, eliminated from school or barred from taking classes, that they're able to breastfeed or chest feed on campus in a safe, clean environment. And so developing a system for oversight and accountability for the college campuses. And I'll stop there. Thank you.
Thank you, Atisha. Thanks for that overview of Western Center's work on doula access and college campus benefits for birthing folks. Sandra, I'm going to pivot over to you now. We are aware that one of the issues contributing to lack of access to care and to the high mortality rate for Black birthing people is the implicit bias of healthcare providers. Can you tell us a little bit about that and about the work that and steps that are being taken legislatively to address this issue?
Sure. Thank you, Sochi, for bringing this up. This is a quite alarming issue, and it does contribute directly to the disproportionate maternal mortality rate of Black women and other pregnant persons of color. So by background, to address this disparity, the legislature in 2019 passed Senate Bill 464 that was authored by then Senator Holly Mitchell, and it was entitled the California Dignity in Pregnancy and Childbirth Act. And that act, which became effective in January 2020, required hospitals, alternative birth centers, and primary care clinics to conduct evidence-based implicit bias training for all health professionals who provided care during a patient's pregnancy, childbirth, and immediate postpartum period. So fast forward a year and a half after the law became effective, in August of 2021, the Department of Justice launched an investigation to ascertain compliance with the act, and a report was issued in October of last year of the findings. Unfortunately, at the time of the investigation was launched, only 17% of facilities required under law to conduct the implicit bias training had even started training their staff. And I believe there was only one facility that actually completed training their staff. So in February of this year, Assembly Members Wilson and Assemblymember Weber introduced AB 2319 to address issues that were raised by the Department of Justice investigation. And I'm proud to say this bill is co-sponsored not only by Attorney General Rob Bonta, but Western Center on Law and Poverty, and also Black Women for Wellness Action Project, as well as other organizations. You know, since the California Dignity in Pregnancy Childbirth Act became law back in January of 2020, we have unfortunately continued to hear tragic stories of birthing people, particularly Black women, dying of preventable issues while receiving maternal care. And again, the cause often points to implicit bias of providers. This is more reason for this legislation. There needed to be some enforcement mechanisms in place behind the law. What we find is that the implicit bias and disparate treatment exists across all income levels. You may have heard stories of mistreatment experienced by individuals such as Serena Williams and Beyonce. And it's just critical that meaningful enforcement mechanisms and clarification of the requirements be put in place to eliminate these preventable deaths and other harms. So what is the status of the bill? I am happy to report that on yesterday, AB 2319 passed out of the Senate. It will be returned to the Assembly for concurrence of amendments that were made in the Senate, and if successful, will be on its way to the governor. And later on, we're going to talk about call to action. So I'm going to reserve the rest of my comments on that for later. But thank you, Zoshi, for this opportunity.
Wow, congratulations. Thank you, Sandra. Amazing work, amazing work. So I think we're going to spend the remaining time with our panelists talking about an initiative that all three organizations are working on collaboratively to improve access to quality maternal care. We've been seeing reports of maternity ward closures across the state. since 2012, almost 50 maternity wards have been closed. Onyema, can you talk a little bit about how that impacts Black birthing people in California?
Sure, yeah, Sochi. I'm sure, Cal Matters has done wonderful, wonderful reporting, right, around these closures. And these closures are not unique to California. They are, we're seeing a wave of this across the country, but California's hospital closures is still really quite alarming. I think they make up the majority of closures across the country or in the country, if I'm not mistaken. But with nearly 50 maternity wards, either suspending services temporarily or permanently. I think 60% of those happened in the last 3 to 4 years. I mean, just in the news in the last week and a half, I heard of 2 more hospitals that have announced closure of their maternity or their labor and delivery services or their full maternity care wards. And that's one in Northern California, in Humboldt, and another in the Inland Empire, in Southern California, right? And so I know that we understand what this means, or at least I perhaps I might be taking it for granted, but I think we understand because this conversation is often talked about in the context of its impact in rural communities, and those impacts are devastating and very real, right? We've heard of stories of mamas and pregnant people having to travel, at minimum 30 minutes. And I think that's a very low estimate to an hour, 2 hours to receive perinatal care. That's prenatal, labor and delivery, postpartum care, right? In rural areas. And these are this is devastating with regard to impact to access, right? Imagine the barriers that presents in terms of access to quality health care, right? Like, we encourage mamas and pregnant people to do all the things, to get the perinatal care, right? To get the prenatal care. But if you have to travel at minimum 40 minutes each way to get there, you're less likely to do that, especially if you have families to take care of, if you have access to transportation issues, right? These are all barriers that prevent you from accessing the care that you need. And this can be extremely difficult in rural areas. And I think we understand that aspect of it. And I'm not dismissing that, but I would like to also just uplift the impact of these maternity ward closures in quote unquote urban areas as well, right? Because I think where we think about where Black mamas, the majority of births to Black mamas occur, they do happen in urban areas. I think the largest is in LA County, followed by like the Inland Empire, and I think the Bay Area. But 34% of births to Black people occur in LA County. And we're also seeing a significant uptick of maternity ward closures occurring in LA County. And what's happening and I hate to use, I'm not going to use the word interesting, but that's the word. It's not interesting and like, ooh, let's, like look at this or ponder it, right? So perhaps the word is devastating, is that the majority of the closures that are taking place in urban areas like in LA County are ones that serve majority Medi-Cal beneficiaries, right? Because one of the reasons that we hear that maternity wards are unable to keep their doors open is due to the low Medi-Cal reimbursement rates. Okay, so if the majority of the patients that you serve are Medi-Cal beneficiaries, then you're sustaining hospitals are operating or tend to be operating at a loss, at least, where they're trying to maintain a full running maternity care ward if the majority of their patients are Medi-Cal beneficiaries. But that's devastating because we also know that Medi-Cal beneficiaries suffer the highest in rates of maternal infant mortality. There is a unique thing when it comes to Black birthing people, though, because regardless of income, socioeconomic status, education level, Black mamas and birthing people still die at disproportionate rates of adverse maternal health outcomes than our counterparts, right? And so there's that piece, but we also have to uplift that there's an exceptional inequity when it comes to Medi-Cal beneficiaries. So when we're closing down maternity wards in quote unquote urban areas, right, that predominantly serve Medi-Cal beneficiaries, we're exacerbating the maternal mortality crisis that persists, right? We're leaving folks without access to healthcare centers, right, that are within the areas that they live. It makes a statement for who qualifies for quality, dignified healthcare, right? We know one of the things we're grappling with is the closure of Centinela Hospital Medical Center's closure, right? They announced their closure at the end of last year, which left that community with two hospitals. One is MLK Community Hospital, which is also often on the news, right? Because it's often in the brink of closure, despite like the great care, the way they've managed to integrate midwives into their labor and delivery care, right? They're often like on the brink of closure because of the costs to maintain their delivery labor and delivery ward. Um, and then there's the other hospital that's also a Prime Healthcare owned hospital, right? And that's St. Francis. And I should note, Centinela was also a Prime Healthcare facility. And Centinela Hospital is where April Valentine met her, like died during childbirth, and one can surmise that it was due to racism, discrimination that really impacted the quality of care that she received, that ultimately resulted in her demise, right? We so that hospital, Centinela Hospital Medical Center, closes its doors, right, and leaves these two options available for mamas in that community, right? One is a hospital that's run and owned by, the same hospital where April Valentine didn't receive, and many others, right, didn't receive dignified quality care. And we know this at Black Women for Wellness because at the time that Centinela announced its closure, we held a town hall to hear from community members about what the impact of this closure would be, and also to determine what the quality of services they were already receiving at Centinela was, right? And we heard a lot of stories about discrimination, about a lack of quality of care, about patients not being heard. Sorry, Sochil, is that a sign to, okay, 1 minute. About the quality of care that they were receiving at Centinela. And the call was to improve quality of care. It wasn't to close down their services, right? But now patients that were served by Centinela don't have a hospital accountable to them. They have to travel at minimum 1 hour each way, right? Via public transit, to get, because we're not going to assume that everyone can pay for an Uber to get to care regularly. We're not going to assume that everybody has a car to get around in LA. They're in an area with stadiums around. So where there's events, there's traffic to get around, right? All of these things present barriers to access to care. And then another thing, and another way that we're thinking about access to care with these closures is, not all hospitals in California offer the full spectrum of reproductive health care available to mamas and birthing people. So even after, like say for instance, a pregnant person delivers and wants to have a tubal ligation, right? It's against some hospital policies to provide that to pregnant people. And so we see that as inequitable access, like that's not complete access to care, and we think that's problematic. And some of the issues that might support improved birthing outcomes, or might support medical interventions that might save a mama's life during pregnancy, aren't offered at all of the hospitals across California. So depending on where a mama has to travel to receive care, she might not have access to the full spectrum of reproductive health care that might be responsive to her needs, right? All of this exacerbates the adverse health outcomes for mamas, for Black mamas in particular, especially those in urban communities. So I just wanted to uplift that that aspect of the conversation, because I don't know that that's being amplified as much. And I think equally, we should think about these issues as distinct, right? The issues that arise with ward closures in rural areas and ward closures in urban areas, but they have the same sort of devastating effect despite the unique perhaps contributors to those. So I just wanted to kind of uplift that and include that in the conversation as well.
Thank you. Thank you, Nyema. Appreciate that. Yeah, poor people in both communities are impacted, right? Sandra, I understand this coalition of amazing organizations and human beings is doing some work on a potential solution to what Onyema was talking about in terms of maternity ward closures and hospital closures. Can you talk about some of that work and its challenges?
Sure. So as Onyema so eloquently described, these closures have had a profound negative impact on many communities of color, rural and low-income folks. And what we found is at the same time that these, what we'll call them maternity care deserts, are being created by these closures, we're hearing that for a variety of reasons, an increasing number of birthing people would prefer to deliver their babies in a birth center than a hospital. After researching the well-documented benefits of delivering in a birth center for low-risk births, that became to be our focus as a potential solution. In California, a birth center does not have to be licensed to operate. However, to be eligible for Medi-Cal reimbursement and reimbursement from some insurance plans, the birth center must be licensed by the state. If you look at the California Department of Public Health website, they indicate that there's 10 licensed birth centers reported in the state of California. However, when we reached out to those birth centers, we found that only 6 were actually still operating. And of those, the majority were not serving people of color. We began to talk to birth center owners, both licensed and unlicensed, and discovered some major barriers in state law that made it very difficult to even obtain a license for birth centers within the state. Knowing the, and I will mention that in order to get Medi-Cal reimbursement, and I might have mentioned that, you do have to be licensed in the state. So knowing the state budgetary challenges and the need to try to come up with a timely solution to this growing problem, we began looking at alternatives that might be available. And of course, that included looking at what other states were doing. Because of the unique operation and purpose of birth centers, some states have chosen to grant deeming status to the Commission for the Accreditation of Birth Centers to meet birth licensing requirements, thus saving the cost of inspecting birth centers themselves and to ensure that birth centers evolve with new evidence and industry best practices. I'm going to just call it the CABC. The CABC has been around since 1985 and is the only accrediting organization dedicated to exclusively to the quality of the operation and services of all birth centers. What we found was that currently the states of Minnesota, North Carolina, and Louisiana deem birth centers eligible for Medicaid reimbursement if they're accredited by the CABC. We also heard that this method was popular among lawmakers in those states who understood that there'd be no significant costs incurred by the state in establishing licensure this way. So Western Center for Law and Poverty, Black Women for Wellness Action Project, and the California Black Women's Health Project began working on a legislative proposal to adopt this model of licensure as an additional pathway to licensing birth centers. Again, the goal is to ease that process so that we could get more birth centers licensed and able to serve Medi-Cal consumers. We do understand that this would not be a panacea for all issues currently impacting birthing people in California, but it would be a step towards increasing access to much needed maternal care. I do want to emphasize that using accreditation versus licensing, that patient safety and the quality of services would not be compromised, and it has not been in the other states. So I'll just say stay tuned for more to come on this as we move forward with this effort. Back to you, Sochi.
Thank you so much, Sandra. Thank you to all the panelists for shedding light on all the powerful and important work that y'all are doing on the ground. So clearly you all have a call to action for this group of amazing organization representatives. There are funders on this call. There are lots of partner orgs here. And I'd like to know what your call to action is for those participating today. What kind of funding, advocacy, organizing work needs to be done to address these issues, in addition to what you're already doing, to really have kind of a really, powerful impact on access, doula care, midwifery care, hospital closures for Black, Brown, and Indigenous birthing people. Can we name our top 3 action items? Raina, how about you?
Okay, thanks for calling me out.
I'm sorry. Okay,
Well,
you don't
no,
have
perfectly. So I'm gonna issue a wider sort of call to action, because we do have a very specific call to action involving our project and the bill that we're working on. But because we have funders here, agency people, and I think I noticed a physician, I would like to say that I want everybody here to be aware that there is a very calculated and organized attack on race-specific policies and programs. It's happening nationwide, even here in California. What a lot of people don't know is these nationwide attacks are coming from an organization that's based in San Diego. Anyway, so they're right here in our backyard. So I want, funders and agencies here to, number one, see themselves as a very crucial and important safety net for the work that happens at California Black Women's Health Project, for the work that happens at Black Women for Wellness. And even in some instances, the Western Center, right? Because, where funding goes and where attention goes is where the money goes, right? And so, folks are almost criminalizing the idea of working specifically on race-based initiatives. And so as folks who are in philanthropy, you don't have those type of stipulations, right? You can really stand out and be bold and choose the type of work you want to do. And in that, in some spaces in philanthropy, we're going to need to address anti-Black racism in our own longstanding institutions, even the ones that we've given money to. Even if you give to organizations that do race-based work, sometimes there's a lot of stipulations and different things where we're still kind of upholding this idea of policing and not understanding, community-defined practices and really believing in them and investing in them. So that is one of the things I wanted to add there. And for agency folks, really also looking at that anti-Black racism piece in your own organizations, something we talk about with agencies. Look around in your own board, look around at your own executive staff. Are there any Black people there? Are there any brown people there? And I say executive staff because sometimes we'll say, oh, we have this number of folks, and then we see they're all low-level program folks. So sometimes we have to really start and look there. Are we redistributing power in our own organizations, or do we want to sort of maintain this sitting high and trickling low idea? And even though that can, that's not just specific to maternal reproductive health, it's extremely important, especially for an organization like ours, who is really concerned with workforce and leaders and leadership and policy making. And we can't do that if we're only doing, surveys, or we're doing focus groups. And all that does is allow us to interpret what people want to do when we make decisions, and they don't meet us and they don't go all the way through to the decision-making piece. So I know that was broad, but that is what I'd like to offer, knowing that there will be some more really specific call to action from our group.
Thank you. And she drops her mic. Thank you, Raina. How about Sandra and Itisha and Onyema? Maybe one call to action quickly, each of you.
Okay, knowing that our time is short, I'll just say get to know your legislative representatives and make your voice heard. And specifically, we're going to ask for your support on getting the governor to sign AB 2319 once it comes up, and we'll be sending some follow-up information for you there. Next.
Thank you. Atisha.
Yeah, I think that for me, one of the most important things you can do is to trust Black women. And what that looks like in action is to place Black women in positions of leadership and authority at your organizations, especially when it comes to making decisions around projects or interventions related to maternal health. Malcolm X said the most disrespected person in America is the Black woman. The most unprotected person in America is the Black woman. The most neglected person in America is the Black woman. And so once we start from there, then everybody else will be positively impacted. But we have to start with who is the most vulnerable in our country in this moment. And sometimes we have a hard time with calling out, saying Black women. Sometimes we just give a blanket term, POC, but not every person of color experiences racism and disparities in the same exact ways. And we have to recognize that as organizations and as people who are in positions of leadership and have the ability and the resources to make change. We have to really focus our work.
Thank you. Thank you, Atisha. Onyema, are you able to come off mute?
Yes, I think that's it, right? Atisha, Reina, Sandra, really speaking to the racist, like the racist attacks, right? On programming that have to do with righting wrongs, righting systemic wrongs, right? Righting these and like when we talk about the disparities in Black maternal um, health outcomes, right? Like these are systemic issues, right? Some of these inequities are not, well, the inequities are due to systemic issues that have been rooted and embedded in our societies, right? And so we have to be real and honest about what it takes to right those wrongs. And as Atisha beautifully and eloquently said, right, like we have to name Blackness, we have to name Black folks and recognize that we need to do work in service of righting the wrongs of our societies, right? So it's to really move towards improved health outcomes, right, or eliminating these adverse health outcomes for Black mamas and other and birthing people. I appreciate, like Reina mentioned earlier, the piece around the reparations work, right? And that's a really important framework through which we can address adverse maternal health outcomes and really being supportive. I think this is the moment to stand firm and take a position because the opposition is throwing spaghetti at the wall and it's really sticking in a really unfortunate way, right? It's really disappointing, the impact that that's having, the chilling effect that that's having across different sectors, right? Including in philanthropy. And so I guess the ask again is just bolstering my sisters on these panels on this panel's ask, right, is to stand firm, be courageous, and continue to support the organizations that are doing true good work on behalf of equity for our communities. I think that's a critically important call to action. And then, leveraging your influence, right? Understanding where your individual power lies and being courageous in how to wield that in wielding that power, I think is an important thing, right? Be it research, right? Like, what are you publishing, right? Can you lend your time and treasure to offer testimony at hearings, right? In what ways can you lend your expertise? In what ways can you wield the power that you have as funders, as community members, as within your organizations to really advance equity, racial justice, and do away with anti-Blackness? I think we all you know, have a power to leverage, and we just need to do that thinking and then wield it courageously. And
Yeah.
so I guess that's also my broad sort of call to action as well.
Thank you, Onyema. I'm so sorry if I cut anybody off today. Do we have any time for a question or one or two? And I know that we're going to run out of time and there'll be questions, so maybe people can put your questions in the chat or email the question to us. We will definitely get it to our panelists and get your questions answered if they don't get answered today. But do we have any questions right now? No. Looks like we're like up against time too, huh? Well, I think if you do have questions, we will be accepting them via email. I just want to thank all of the panelists for being here today and for dropping so much knowledge and so much care, wisdom, just community love here. I appreciate each of you. We appreciate each of you. Thank you, Heather Masterton and Nora Olobaju, for kind of doing all the back end work on this. On the Zoom, we can't do it without everyone's help. So it really does take a village here. And thank you all who participated, who joined us. We hope that this was insightful and educational and inspirational. And we hope that some ideas come of this, and that, people are inspired to coalesce and meet the needs. So
Someone asked if folks can share emails in the chat for questions.
yes,
So if the panelists want to put their emails in the chat, or if there's going to be a follow-up, people
There's-
are asking about
there'll
email.
be a follow-up email, and you can we'll put links to each of the panelists' full bios and organizations, as well as ask for questions. Raina just put hers in there, so you want to grab it. Thank you all so much. Appreciate you all.